Hi, this is your Houston chiropractor coming to you today with Mario, who's traveled all the way over here from San Antonio to see us. He actually saw us on YouTube, right?
I did.
From a friend that saw me on YouTube and referred you, correct?
That's exactly it.
Yeah, so he's over here in Houston doing some business, so he came to see us today. Renee worked him in, which is great, so we're happy to see him. So this is his first visit, so I'm going to show you exactly what we do with the patient on their very first visit. And he also has some acid reflux issues that hasn't really been treated or worked on yet, except for over-the-counter stuff, right?
Correct.
Okay,
Correct.
Let's take a look in the mirror here first. Let your hands out of your pocket for a moment. Now I'm going to have you flex your head forward and backwards for me, Mario. Keep your eyes closed, and then put it back where you think is neutral. Take a deep breath in, keep your eyes closed, let all your air out. So he's got a forward head translation and a head translated to the right as well, and he's a side sleeper, and his head deviated off to the right, and he's also rotated. You see his hands are way out in front of him right now. That's an indication of the forward head posture and rounded shoulders there, which we see that on most every single new patient, so that's not anything unique to you, Mario, but I wanted to point that out because that's going to be one of your homework exercises. I always send patients home with homework. Not too much homework, but enough to get them to where they can help themselves. All right, very good. And I've already referred him to a chiropractor I know in San Antonio. You're seeing me wear this Chiro Trust t-shirt today because there's an elite group of chiropractors around the United States. Let's go ahead and lay on your back here first. Yeah, I'm getting ahead of myself. Okay, we're going to lay here first. Okay, so just lay down flat. Now I'm going to lift your leg up. Tell me if, besides the tightness in your hamstring, is there any lower back pain or shooting leg pain?
Just kind of in the middle.
Okay.
Part of my lower back.
Okay, so he does have a positive straight leg raise of pain in his lower back. Does it feel better down here?
Yeah.
Okay, does that hurt your lower back the same way? Or leg pain? Okay, let's cross this leg over here. So he's got a positive straight leg raise, but a negative Bragger's. Now I'm pushing down here. Tell me if this hurts deep in your hip joint or your back.
No, my lower back.
In your back, okay. So that's not really a positive Fabry-Patrick's test because it didn't hurt in his actual hip joint, but it did cause low back pain, so that's indicating his pelvis is out. Does this cause any low back pain?
Mm-mm.
Okay, just the tightness? Okay, does it feel better down here?
Yeah.
Any pain there? Good. So he's got a negative straight leg raise on the left and a negative Bragger's. Does that hurt anywhere?
Yeah, my lower back.
Lower back. So again, that's telling me it's his pelvis out, not his actual hip joint. So that's a negative Fabry-Patrick. I'm going to have you lift your head up for me. Tell me if this hurts anywhere in your spine. Okay, good. Let's sit you up and face towards Renee. Face towards Renee since everybody's watching the exam. Now, if you go to a chiropractor, they should be doing these. This is called Orthopedic Neurological Examinations. This is a foramina compression test. Now, does that hurt anywhere? Okay, now, this is a maximum foramina compression test. How about that one? More so in the lower neck?
Yeah.
Yep. Now we're going to go backwards and left. This one?
Yeah.
Same thing over here?
Yeah.
Okay, just tilt. That's a positive maximum foramina compression test bilaterally. Does that tighten up or hurt through here at all? How about when I do that?
Some tightness.
Okay, just tightness. That's not really a positive shoulder depressor test then. He's got better range of motion to the left. How about this one? Does that hurt any worse? Okay, so he's got negative shoulder depressor test on both sides. Turn your head like you're looking left for me. And now right, like you're looking right. And you can tell this is the way he sleeps all the time with his head turned that way, right? Yep, now look straight ahead. I'm going to test his deltoid now, which is C5. I'm going to push down. Excellent strength. I'm going to push down, resist. Good. Okay, so then we're going to come around the front. And I'm going to check his reflexes, but I'm going to check his muscle strength first. I'm going to check his biceps, so I'm going to pull out, resist. Good, now relax. I'm going to reposition you, and I'm going to push in, do your triceps. Hold. Good. Okay, so I'm testing C5, C6 on the biceps, and C7 on the triceps. Hold. And hold. There you go. Good. So far he is neurologically intact. Just let that totally hang in my hand. There you go. Okay, biceps reflex fine. If your brachioradialis is fine, triceps is fine. So those are +2 on the left upper extremity. Biceps reflex there. Brachioradialis, triceps all good, +2 equal and active. Patellar reflex on the right is normal, and on the left is equal and active at +2. Now I'm doing his Achilles. Just relax your foot. Let me hold it. No, you're tightening it up. Let me, no, don't tighten anything up. Just let me hold it. No, don't tighten anything. Let me hold it. There you go. Alright. Oh, there's a problem. We like to have fun in here too. Okay, so now I just need you to walk on your tiptoes about 3 steps that way, please. Okay, this is called a toe walk test. Now turn around and walk back towards me on your heels only. Excellent, good. Now stop right there. Put your feet together all the way. I want you to close your eyes. This is a Romberg test. I'm just making sure he doesn't fall over side to side on one side or the other. That's negative. That's good. Now, if you put your feet shoulder width apart and bend over like you're going to touch your toes, tell me if and when that hurt your back anywhere. Hurt right there?
Yeah.
Lower back?
Yeah.
Okay, so he's got diminished lumbar flexion at about 50 degrees. So now lock your knees straight, but lean backwards. Does this hurt your low back as well? Okay, now cross your arms up in front of you like this. We're going to lean backwards, and I'm going to twist you left and push down. Does that increase the pain in your lower back? Don't bend your knees now.
Okay.
Does that increase the pain in your lower back? Okay. Does this increase the pain in your lower back? So that's called a Kemp's test, and that was positive bilaterally. That indicates lower lumbar spine problems. So next thing I'm going to do is palpatory examination. I'm going to have you lie on your stomach for me here now, Mario, with your face right down in here. So his orthopedic neurological evaluation shows that he does have mechanical back pain starting in his sacroiliac joints in his pelvis, and his left leg is short by ½ an inch here as well. He sits on a big wall on that right side, as you can see. I bet you that tightens up in your low back right there.
It does.
And your thighs too. So he's got a positive knockless test because his pelvis and low back raised up and tightened up and caused pain. Plus, that's pretty tender right there, huh?
Yeah.
That's where you get most of your pain, huh?
Yeah.
And even on the right side right there.
Yeah.
Yep. So one thing is to get him off of this wallet and don't sit on that. You men, I know, hate hearing don't sit on the wallet, but that's, no, those are all sore, aren't they?
Yeah.
Yeah, see, he's got L3, 4, and 5 all posterior down here, so he's got a loss of his lordosis down here. It's flattened out. Should be a nice forward curve. T5, 6 out right there, that's tender too, huh?
Yeah.
And he's going to have a lot of tightness right here in the thoracolumbar, which is a transition zone and a stress area in the spine. From the mid-back into the transition to the lower back curve. It's tight right there on both sides. Okay, and then we're going to come up to his upper back and traps. T1 and 2 are translated, actually rotated as well to the left. And that also is contributing to that right there. So you feel that one on the right?
Yeah.
That one too. And I bet you when you get your headaches, they start right here and go around.
Yeah.
Suboccipital trigger points bilaterally. Atlas is out on the right. C4, 5, and 6 are all right. That's because he's sleeping with his head cocked over to the right. All right, you ready to start feeling better?
Yeah.
Okay, so this is his very first adjustment here at Advanced Chiropractic Relief. I'm going to start off with his right SI joint here. And then we're going to adjust his left SI joint. Now, I didn't do a sacral deviation test on him today because I know it's already deviated from the test I did previously to the left here. So now I'm going to adjust his sacrum, which is the middle bone in his pelvis, straight superior to inferior on the y-axis. And then on the right side, same thing. And then I'm going to get it right in the center, straight down. Not in the z-axis, but the y-axis. So now we're going to hit L5. And I'll wait on his breathing. There we go. That's probably going to be a little sore right at first here, Mario. There's L4. L3. L2. Now, I'm going to get an angle down here. You notice my angles changed significantly. That's perfect. Boy, that was a good one. I'm going to put your head down just a little bit. This is a standard diversified palmar adjusting technique. mid-thoracics. Excellent. Okay, now up here you have to get a kind of a superior to inferior angle because of the joint angles. Okay, I want you to exhale for me and don't tighten up. Okay. Okay, that's all she's going. I'm gonna have to get these like this. Let your head go right in my head. Don't tilt it. Let me do the work. There it is. I know you felt that, and I know you heard that. See there? Perfect. I bet you never had that done before. So we're going to go down and recheck everything now. From the base, his legs are exactly even now, and I bet you this hurts less than it did the first time. Doesn't tighten up as much, does it?
No.
So this, if you do this type of work, this is known as BioPhysics. This is really my own technique, BioPhysics. It's not chiropractic BioPhysics, which is Dr. Deed Harrison work. I have adapted my technique from Palmer, from all the postgraduate education seminars I've been to with Dr. Dan Murphy, and have really developed my own technique that I utilize, is three-dimensional biophysics, which is similar to chiropractic biophysics, but not chiropractic biophysics, because they do a lot more cervical traction and general lumbar roll tractions to get the curves back in the lumbar spine and the cervical spine, which are absolutely necessary for a healthy spine, by the way. So chiropractic biophysics is absolutely the most researched and scientifically proven technique on the planet. But in the coming years, you're going to start hearing Johnson biophysics, because we're starting to introduce my technique to the world. And I'm hoping that Palmer College of Chiropractic picks it up into their curriculum and start teaching at Palmer, where I went to school. And most of the Chiro Trust doctors, in fact, all of them, have pledged to treat patients by utilizing mostly physical medicine, hands-on stuff like what I do, as opposed to physical therapy modalities like hot packs and cold packs and electrical muscle stim and diathermy and roller tables and all that stuff. Okay, this is going to sound like I'm cutting you in half, but I'm not. Very few patients that I actually do the turbinator on the very first visit, but you were a candidate for it, so I did it. This should feel even smoother this time.
It does.
Yep, good deal. Okay, so let's turn you on your back now.
I was secretly grinching my teeth.
Oh, I know. That's the white knuckle treatment there. That's one of those hurt so good techniques.
Yeah.
Okay, let's lay you on your back now.
Okay.
So now I'm going to adjust his cervical spine with the Palmer Diversified, put your hands on your tummy, cervical rotary brake. There we go. Drop it right in my hand. That's it. Yep, everything's moving, huh? Bet you didn't know you were that noisy. Feels like noisier inside too, doesn't it?
It does.
Okay, so now I'm going to check his stability in his knees, which is pretty good. So I'm going to adjust his hips and his knees right there. Did you feel that in your knees and your low back?
Yeah.
Good. This kind of decompresses the lumbar spine and sacrum from the bottom as opposed to that over there on the top, which we are also going to do. Relax this leg. There we go. That was better.
Yeah.
You feel that one more?
Yeah.
Okay, let's sit you up and face towards Renee. And get sideways. There we go. So I'm just going to check his right shoulder range of motion. We got a lot of popping and grinding going on. You feel that right there? His bicipital tendon's out. So I just adjusted his glenohumeral joint on the right shoulder. And I'm pulling the bicipital tendon back in every time I rotate it around like this. Left shoulder, same thing. That moved good. Now we're going to check his elbows. Just relax this. Good. Wrists. Perfect. Digits on each hand. Pulling your knuckles straight out and popping them like this is fine. If you jam them like that or cause trauma to them, that's what will cause arthritis. But the popping that you're hearing in the joints isn't really your bones cracking. Can you move your watch up a little bit? Thank you. It's a nice watch.
Thank you.
There it is, right there. Okay, now for the eye opener. Let's come over here on your back. Now this is very first visit, mind you. So I'm going to have you lie on your back for me, Mario, with your pelvis right there. He's getting the full meal deal today. Johnson full treatment. Johnson BioPhysics treatment. And this is the very unique part about what we do here. We have people from all over the world flying in here to see us because of this right here, and also because of the hiatal hernia and acid reflux work that I do. Not actually treating hiatal hernia or acid reflux, but what causes it. And we've already started doing that with Mario. See, he's got excellent reflexes right now. There we go. Good. Okay, now I want you to take a deep breath through your nose, let it all out, and just relax. Oh, yeah. Should have felt that all the way down, did you? Did you feel it all the way down? Okay, good. And see, he is still kicking. Yep. See, he felt that in San Antonio. Alright, so that was a great job. Now, I want you to stay laying on your back for me there for a second. I'm going to pull your stomach back down through your diaphragm to get rid of your acid reflux. You get pressure under there too? Yeah. Like under your sternum, under your ribs? Mm-hmm. He's a little tall, so sometimes these pads slip up. We're getting a new table, actually custom designed, which should be ready in 2016, and we will be selling those. But you're going to have to learn how to do this technique first. I won't let anybody buy one unless they know how to do it. Take a deep breath in, let all your air out, and just exhale. Keep exhaling as I pull your tummy down right there. You feel it? Okay, another deep breath in, let all your air out. Now, you see that I have some forward head posture and forward posture too. Now you know where I get it, doing this just all day on everybody, all week. Every week, every year, year after year for 34 years now. And I'm still pulling down. This is the last one. Did it 3 times, third time charm. Excellent. Okay, now let's stand you up over here in front of the mirror. And when you get up, you always want to step sideways like that. Good. So, now I'm going to adjust his atlas on the x-axis to help his cerebellum remember all this. So I'm going to have you flex your head forward and backwards, Mario. It's already looking better. Yep, better range of motion already. Okay, back to neutral. Okay, see his hands are still a little bit out in front of him, so here's what we're going to do to help him correct that. This is going to be your homework, Mario. You're going to lift up with your traps, pull back simultaneously with your rhomboids, flare your hands palms forward. See how it tightens that entire trap up. Here's the most difficult part. Head straight back first. And then translate to the left because yours was to the right. And now shift your pelvis straight right. You're a little bit rotated. Stay straight. Shift right. There you go. Lift your chin up to the ceiling. Keep those hands way back here. Because right now, when I'm doing this atlas adjustment, this is going to send a barrage of neurological information in the cerebellum. Relax. Okay, now flex your head forward and backwards again. Watch the range of motion improve. I bet that was smoother that time.
No kink.
No kink that time. Not to neutral. So his hands have come back a little bit to his size, better. And we're way out in front of him. That's a lot better, huh?
That is.
You're even right here, and you're not leaning so far over to the right now. You're pretty much three-dimensionally corrected, which is what we're talking about with Johnson BioPhysics. The x-axis, the y-axis, and the z-axis should all be centered biomechanically so that when gravity's pulling down on us, it doesn't degenerate your spine. Okay, Mario, let's look at Renee. So, if you had to tell the people from out of town, throughout Texas or United States, if it's worth the trip to come here, what would you tell them?
Absolutely, absolutely. I mean, it just feels better. I mean,
You feel lighter, right?
Yeah, I feel lighter, and I didn't realize that
Had all those kinks in there, huh?
That could actually sound that way.
Yeah. Well, you did great for your very first time.
Thank you, Dr.
Thank you for letting us video that.
Absolutely.
Welcome to Houston. And he's going to come see us when he's back here in Houston. I've
Absolutely.
referred him to a chiropractor in San Antonio already. So, listen, this is your Houston chiropractor. We'll see you next time.